Hi everyone, it's Jenny again. In this video, I'm going to take you through a lower abdominal progression. Now I want to emphasize lower abs are not the same thing as upper abs. Upper abs are what we typically think as the sexy six-pack muscles. That is not what I'm going to teach you to activate. The lower abs are actually lower, kind of closer towards the pelvis, towards the pelvic floor, all down there. That is considered our primary stabilizer for our low back muscles. So if I ever hear someone telling me they have low back pain, it could be because their lower abs are super weak. So I'll first take you through what I call pelvic tilts, so you can first find your lower ab muscles, and then we'll progress to level 1A and 1B. I won't take you further, mainly because I myself can't do more than that. So if you do come to my office and you're doing much better than me, then I will progress you as long as I can see that you are stabilizing well. Okay, a few things to talk about first. So lower abs are down here. So here's my pelvis and this is my pubic bone. Low abs kind of sit right in the middle. What I want you to be mindful of is if during any of these exercises your stomach expands up towards the ceiling, you're activating your upper abs. Lower abs should be kind of like a corset where it's knitting together and stabilizing your lumbar spine. So what I like to do sometimes is stick my finger underneath my patient's back on the spine and tell them to first do a pelvic tilt where they're tilting their pelvis down, kind of rounding up, flattening their spine, and then to release. So you can do that a few times to really get all these muscles tightened up. You can tell none of my upper abs have activated. Upper abs start from here and insert to pubic bone. So if there's anything that comes up, that's all upper abs. So we'll do that again. We suck it in and we pelvic tilt, and you should be feeling it all right down here. So now that you have found your lower abs via pelvic tilt, we're going to go into the next progression. So I always say, as long as you can maintain the pelvic tilt during all of these exercises, you can continue on to the next level. However, if at any point in time your back is starting to arch during any of these exercises, that's where you need to stop, because I don't want to cause you back pain. So let me show you level 1A. First, activate your low abs, pelvic tilt. 1A means pull your knee past 90 degrees. So I'm using my hip joint as a guide. So 90 degrees would be here for me. Past 90 degrees would be here. So I'm gonna start again so you can see. I'm gonna pelvic tilt, past 90 degrees, suck it in, pull the other leg up, make sure you don't lose it, and then you can bring it down. So I like to alternate so both sides get equal workout. Really suck it in and then pull it in and then down. So I don't tell my patients to do more than 10, because this is, like, for me, even hard work to do this. Do it super controlled, because if any point in time you start arching, then you need to stop. So once we've done 10 of these and you are very stable, I'm going to show you level 1B. So that is just pulling up to 90 degrees, really making sure you've got your low abs activated. And this is where it's going to get hard for me. And I'm going to struggle. So then you pull your knee up to 90 and then back down. So every time, if you need to, reset. Go to the other side, stabilize, and pull back up. And then you do up to 10 repetitions. So I'll just kind of go through another set on both sides, you can see. And right now I'm starting to lose it, so this will probably be my last set. I'm going to really try to stabilize better. And there you go. Hopefully this is going to help strengthen your low abs to help control. Again, in theory, all our low abs should be activated whenever we're moving. However, during our daily lives, I for sure know I don't always have this activated, so I need to remind myself to always find this and to do these exercises, if you can, daily, to make sure that you're remembering kind of how to engage these core muscles.